All right, let's talk about hospice care. It's a field that's all about compassion, right? But right now, it's really at a crossroads, facing some major challenges. We're going to dive into the policies that are making things tough, hear from the folks right there on the front lines, and then we'll look ahead at what's next for end-of-life care. So let's jump right in. I think this quote just says it all, doesn't it? One of life's most tender transitions. Before we get bogged down in all the policy stuff, I really want us to keep this in mind. This is what it's all about. It's about people, it's about connection. This is the why that drives everything we're going to talk about today. Okay, so here's our game plan. First, we'll tackle those big regulatory hurdles. Then, we'll zoom in on Texas to see how it's all playing out on the ground. After that, we're going to get to the heart of it, the human side of hospice. And we'll finish up by looking at the future of home care and why speaking up is so important right now. All right, let's get into it. First up, regulatory headwinds. We're talking about new rules that are having a really big impact on how care gets delivered day in and day out. So the first big problem we're seeing, those telehealth flexibilities that were frankly a lifeline during the pandemic, well, they're expiring. And for a lot of hospices, especially out in rural areas, this is a huge deal. It's creating real barriers to getting care. Let's look at what that actually means for people. And you can really see the difference here, side by side. On one hand, with telehealth, you could get an immediate virtual consult for pain management. Boom, instant help. But without it, now you're talking about a long, difficult trip for an in-person visit. That means delays in getting crucial care. We're talking about a massive difference in a person's quality of life. And it doesn't stop there. There's another potential hurdle coming, and this one's from the DEA. They've put forward this new rule about special registrations for telemedicine. The bottom line, it could make it way harder for hospice providers to prescribe necessary pain meds online unless they've already had an in-person visit. You can imagine what a huge setback this would be for getting people the comfort they need when they need it. And look, this isn't just a few people complaining. We're seeing a really united front on this. Major players like the Alliance for Care at Home, the American Academy of Hospice and Palliative Medicine, a whole list of key organizations are pushing back, telling the DEA to rethink this. That tells you just how critical this issue is for patient care all across the country. Okay, so that's the view from 30,000 feet. Now let's bring it down to the ground level and see how these federal rules are actually affecting things locally. We're going to take a look at Texas. And in Texas, it gets even more complicated. It's not just the federal rules they're dealing with. If a provider wants to serve patients on Medicaid, they've got this whole extra layer of administrative hoops to jump through. And here's how that process breaks down. It's a very specific order. You absolutely have to be set up to serve Medicare beneficiaries first. Only then can you enroll in federal Medicare. And only after all that can you finally enroll in Texas Medicaid. It just goes to show you how tangled up the state and federal systems can be and the kind of red tape providers are up against. All right, that was a lot of policy and paperwork, I know. So let's shift gears. Let's move beyond the rules and regulations and talk about what this is really all about, the human side of hospice. Of course, patient comfort and dignity are the top priorities, but some of the most profound needs people have at the end of life, they're not clinical at all. They're emotional, they're spiritual. And this is where great hospice care really makes a difference. And this quote from Jason Cooper at Vitas Healthcare really hits the nail on the head. He says there are some aspects of the end-of-life experience that clinicians are not equipped to handle. And that's so true. Your doctors and nurses are amazing, but they can't do it all. And that, he says, is where hospice chaplains come in. They fill a role that is just so incredibly important. But this idea of holistic care, it goes even deeper. Think about this. Fulfilling a person's final wish. It sounds like a wonderful, kind thing to do, right? But what if I told you it's also good medicine? It sounds a little out there, but there's actually research that backs this up. And here it is, the key finding. A recent study found that helping patients fulfill those bucket list items can actually lead to better clinical outcomes. That is a huge deal. It's proof that this isn't just some nice-to-have fluffy idea. This kind of compassionate, personal care has real, measurable health benefits. So when you pull all of this together, you've got these policy challenges on one side and these deep human needs on the other. What's the path forward? Well, it's pretty clear. The future is home care, and that means it's time for advocacy and action. And Dr. Steve Landers from the National Alliance for Care at Home puts it perfectly. He says providers must advocate for themselves and for their patients. The message is clear. You can't just sit back and let policy happen to you. You've got to be in the conversation, fighting for what's right with legislators and government agencies. And this isn't just an abstract idea either. There are real opportunities to do this. For example, November is National Care at Home Month. It's this perfect built-in time to honor all the amazing providers out there, and, just as important, to make some noise and get the community and policymakers to pay attention. And you can see that momentum is already building. Just look at some of the upcoming events. You've got National Care at Home Month, a big conference in New Mexico, another one for Texas and New Mexico. The community is absolutely getting organized, coming together to learn from each other and make their voices heard. So, this really is the big question we're left with, isn't it? Our population is getting older, and the need for this kind of compassionate, home-based care is just going to explode. So, how do we make sure our policies are actually supporting that care instead of getting in the way? It's a huge question, and honestly, we all have a stake in finding the right answer. Thanks for watching.